Alright, so we're going to just go through the physical examination for the elbow here, which is typically done for a thrower, maybe a tennis player or a golfer. So you can see we have our individual with elbow pain here today, and we're going to start basically by seeing the amount of range of motion first. Make sure that there's a normal motion, full extension, full flexion, then full pronation, and full supination. And I think it's a good idea to keep your fingers on the joint line laterally, and as well as medially, to see if there's any crepitation or any swelling or sense of discomfort there. Now, when we're checking a thrower's elbow, you think of what structures might be involved. On the inner side of the elbow, on the medial side of the elbow, we'd be concerned about, of course, the ligament, as well as the growth plate if it's in an adolescent, or the flexor tendon. So to help define where these things are, we'll look just to do some outline in here. So that's the medial epicondyle of the humerus right there, and the ulnar nerve runs right behind it here. There's a little bump right here called the sublime tubercle, right here. And the ligament, the ulnar collateral ligament, runs this way, and the flexor tendon runs this way. In some people, it can be hard to feel the flexor tendon, so if you just have to make a fist, and if you palpate, then relax. If you feel what is tightening and then relaxing with the contraction, go ahead, Nate. Yep, so I can feel his tendon running from here to about here. So the tendon is here, the ligament is right behind the tendon, and the nerve is even further behind the ligament. So the crucial part of the exam is just to locate where the tendinous is. Is it here on the bone, which would be compatible with a stress fracture or a growth plate injury? Is it here at the tubercle where the ligament attaches? Is it along the ligament? Is it along the tendon? Or is it along the nerve? These structures are very close together, so you need to sort out which is which before you start palpating to see where the tenderness might be. So now, we'll go through the physical exam step by step. What I'm going to do first, we've already checked the motion. We're going to, excuse me, we're going to check the function of the flexor tendon. Remember, the flexor tendon involves multiple muscles with multiple functions, so I'll check them in sequence. So to check the finger flexors, just have them start with his elbow straight, ask him to make a fist, and I'll pull against it hard to see if that creates any pain up in this area. Then I'll ask him to do a wrist curl. Good. And then to pronate. Good. Now, pronation in that position often is done partially by the shoulder. The shoulder will substitute for it. So you need to flex the elbow and ask him to pronate once again. And if you can focus right in there, as he does, as you can see the flexor tendon bulging out a little bit. One more time. Bulging out a little bit. And you just want to see if that provokes discomfort. To look at the ligament, we want to put valgus stress on the elbow in different angles of different degrees of flexion. So we'll start out near extension. I'm using this hand to brace the lateral side of the elbow. And then just relaxing. Good. I put a little valgus stress on it. You can see his elbow toggle just a little bit, and that's normal. I'm using this arm to lever against, but also to keep the shoulder from rotating. You can be fooled if you allow the shoulder to rotate. So I'm holding his shoulder still while I apply the valgus stress. And then we go ahead and apply valgus now by pulling on his thumb, using this hand as a brace. And I'm moving through different flexion angles. This is called the moving valgus stress test for obvious reasons. In throwers, it usually hurts up in what we call the shear zone, with the elbow at about 90 degrees of flexion, with the arm abducted. So more or less where he would be if he was cocking to throw a ball. Up in this position up in here, we call this the milking maneuver, again by pulling on his thumb. Or this can actually be done by the patient themselves. Go ahead and reach around. Good. And try reaching around behind your arm. There you go. And sometimes athletes will come in and say, yeah, when I do this, it bothers my elbow. And that's the milking maneuver. Essentially the moving valgus stress test in maximal flexion. So again, you can see the ligament would be in this area right in there. I'll stress it and then ask them, does it hurt? And then does it hurt here? Just to localize that. To check the ulnar nerve, you percuss along the nerve, see if it provokes pain or numbness or tingling down into the fingers. To look for an olecranon stress fracture, palpate along the olecranon, back here. And then to check for posterior impingement or valgus extension overload, you do what's called the bounce home test. This is if a pitcher says it hurts when they spin a curveball, usually that means as they fully extend their elbow. So you reproduce that just by letting the arm drop out straight. If that is painful for the patient, you only get one shot at it. It usually hurts so much they never let you do it again. So that takes us through the medial side of the elbow, the posterior elbow, and then on the outer side of the elbow. Especially in adolescence, we worry about a problem with the radiocapitellar joint or osteochondritis of the capitellum. You want to find the radial head, which means rotating the arm with your thumb on the radius to find where the bone is moving. And then right there, I'm in between the radial head and the lateral condyle of the humerus. I rotate to see if there's any crepitation or tenderness there. And then the one thing that's a little uncommon, but you definitely see it in throwers, is a posterolateral synovial plica, meaning a thickened band of synovium that develops in the back outer gutter of the elbow, in this area right here. The thrower will typically complain of a pain or maybe a painful popping in the back outer part of their elbow as they bend and extend the elbow. So you just push your thumb right in there. You're trying to trap the tissue between the bone and your thumb as you flex and extend the elbow. And there will often be a little pop right under the thumb as you do that. Okay. So now I'll just run through the whole exam like I would in the exam room without stopping to explain and show you about how much time it takes. Okay? So we'll just start from the beginning. So just flexion and extension, pronation, supination, and just go through the palpation to see if it's tender here, here, back here, on the nerve, or maybe on the tip of the olecranon. And go ahead and make a fist. Good. Do a wrist curl. Good. Now pronate. Good. And then we'll go ahead and check for stability of the ligament, like so. Then we'll go through the moving valgus stress test. You're up into a true milking maneuver. Do the percussion along the ulnar nerve. Then just let the elbow drop out. And then check the lateral side, as well as back in here. And that's it. Thank you.